This episode, I kind of wanted to build off the last episode and reference the two biggest misconceptions that I had about nursing. But I think it's more important to do your research. So I just want to kind of talk about a conversation I had with a fellow medic turned RN and just kind of build off that last episode. So, welcome to my podcast. Building off that last episode about the two biggest misconceptions, I know those were two things that kind of stuck into my head when I thought about nursing. Was was I going to have a loss of scope of practice, and if I was just going to stand around and take orders all day? But I was speaking to another medic, and that turned RN, and we was talking about feeling lost. Not too long after we started practicing as an RN, and I think that went. And one of the things that we discovered was the reason we felt lost is because we didn't have a why. And a why is a reason that you got into nursing, a really good, solid reason. And I talk about my reason. My reason was I wanted to become an advanced practice provider. I wanted to be a nurse practitioner because I redirected from going to a PA, from looking at trying to go into to track to from a PA program to nurse practitioner. But when I got into the ED and I saw what PAs did, and I saw the hospitalists as nurse practitioners, and it just kind of changed my mind. I remember me and my wife was doing one of my lunch breaks. We was down in the cafeteria, and I ran into one of the fellow ED nurses that turned nurse practitioner, and my wife was right beside me. I hadn't seen her since she started working as a hospitalist, and I asked her. I said, "Hey, how you loving it?" She looked me right in my face and said, "I'm not." And I think at that point, that's when I became really lost because as me, I'm kind of like a researchy type guy. So as I started to look and I wanted to know why she wasn't happy. Well, it was because her caseload was like 24 patients. She had to see 24 patients a day. And that type of order writing and seeing the patients and going back and forth, it I can imagine it'll burn me out too, because that's not the vision that I had that you would do as a nurse practitioner or a PA. So I think it was at that point I kind of got lost. And what I mean by lost is where I thought I wanted to work, now I don't. So at that point, I'm starting to think, well, what am I going to do? I'm here nursing. I'm a nurse, but I don't know what I should be doing nursing. So I started bouncing around. I went from ED to pre-op, back to the ED, care manager, ICU. I just kind of bounced around, and in that I picked up some really good insight. Believe it or not, I figured out what my track is, and I realized one of the things that didn't know was that there were different type of advanced practice RNs. So I eventually found my fit. I found my path, which way to go, but it only because I did some research. Maybe you guys can, to save you some time, do some research. What is it that you want to do, and just try to research within that nursing profession. Because I can tell you from now hindsight, I can give you some really good perspective to help you narrow down what you want to do. So one of the things is to understand that there's some positive sides of nursing and there's a negative side to me that I think when it comes to nursing. So I like to call it the good side and the bad side. So the good side is that nursing has a lot of lateral mobility than a paramedic had. For example, I can go from the ED, I can go to the ICU, I can go to the PACU, I can go to interventional radiology, I can go to labor and delivery, I can go to case management, I can go to care management, I can go to be a utilization management, diabetes educator, you name it. That's a good side. Also, not only that, is each area of nursing has its own specialty. So you can specialize and get board certified in that specialty that you're in, and you can become more or less like that can be your specialty. For example, just like paramedic have the tactical paramedic, you have the community paramedic, you have the critical care paramedic, and even the flight paramedic board certification. It works the same way in nursing. Each area of nursing has a board certification. Usually, they want you to work 1 or 2 years in that area so you can gain the knowledge, and then you can go for this proficiency testing, and you can earn the board certification letters that prove that you're board certified in that area. For me, one of the things I did was different areas I worked in. I attained those board certifications. For example, from the Board of Certified Emergency Nursing, I've earned the CEN, which is the Certified Emergency Nurse. I've earned the TCRN, which is the Trauma Certified Registered Nurse. I've earned the CFRN, which is the Certified Flight Registered Nurse. The the CTRN, which is the Certified Transport Registered Nurse. And from a critical care standpoint, I have the CCRN, which is the acute critical care nursing adult certification. So I have 5 board certifications, and those are the areas that I specialize. Now, if you there's other areas, for example, if you are oncology, they have a you may be an oncology nurse. They have a board certification for oncology. I have one for case management, operating room, cath lab, all of them where you can prove your excellence and your specialization. Now, the bad side to me is that there are too many choices. And because of that, we tend to hold on to what we know. And so for me, I got out of the reason I got out of being a paramedic is because I got tired of, being in the street. I got tired of being on an ambulance, and I just wanted some change. But that's where I felt more comfortable. So when I got to nursing, I kind of went that same path. Number two, because nursing is so different, it's easy to get imposter syndrome. And what imposter syndrome means is that you kind of lose your confidence. Because if you really think about it, I give you an example. In the ICU, I went from being a paramedic to where maybe 1 or 2 drips I would have on a patient. Now in the ICU, looking at 8 drips, CCRT, SWAN numbers, and I'm thinking, holy shit, this guy's really sick. And two of those 8 drips are titratable drips. So I'm running Q1 hour, um, to as far as my devices, I'm running, Q15 vitals. It's a lot, and that's not even to mention ECMO. So sometimes you may feel like you can step off the bridge into some deep waters, and you feel really uncomfortable. So think about this: if you trying to, if you want to come to nursing, do your research first, find out what you can, and try to see if you can single out an area that gives you that interest. If you do that, I think it'll give you a more realistic view of what you're about to get into. And I guess this should have been probably one of my first episodes I should have talked about was understanding your why for getting into nursing. If it's just for money, then you might as well just stay as a paramedic because you may earn more money, but you may not like what you're doing. So I just want you guys to get just a little bit more laser focus. And I see you over the top. Happy nursing.